Veterinary care clinics in the Upper Peninsula and across the nation are experiencing a workforce shortage. Local 3's Brianna McLean speaks with a veterinary care clinic in Marquette about this shortage and its impact on their clinic and how the public can help.
You know, everybody's trying to figure out the best way to provide the necessary care, but also not be so overwhelmed that you can't provide good quality care.
This is Tracy Nyberg. She opened Stuga North Veterinary Care in Marquette in October of 2020. In that amount of time, the clinic has seen about 4,500 pets from 2,400 clients.
A lot of other clinics, it's a lot bigger, but they've been open for 15 years. So, I mean, that's pretty telltale of growth, you know, in veterinary medicine.
For the time being, Nyberg's clinic will not be accepting new clients due to being overwhelmed with the amount of calls from people wanting to be clients.
Over the last, I'd say 6 months, averaging, when I look at new clients, it was about 30 a month we were adding when we were trying to put the brakes on a little. But some days we'll get, over a dozen calls from people looking to see if they can be clients.
Other clinics in the UP are experiencing the same problem, including Thompson Veterinary Clinic in Manistee. In a written statement to Local 3 News, they said in part, "In the last year, we had to turn away new clients as we were having trouble keeping up with our existing clientele. Recently, we have updated our policy to accept new clients for routine care, but they are being scheduled into 2024. We are doing our best to do all that we can while trying to allow our staff and doctors time to have a life outside the office." In the United States, there are 33 schools accredited in the field of veterinary medicine by the American Veterinary Medical Association. According to the AVMA, Michigan State University is the only accredited school in the state of Michigan and has a 9.8% acceptance rate into the program.
It's hard to get in. It's a really, small faculty to student ratio, so a lot of hands-on learning, and it's an expensive education to get. But there are more veterinary schools. Almost every year there's a new one opening in the country, so that's encouraging too.
With this veterinary care shortage, Nyberg shares what the public can do to make sure your pets get the care they need.
So we kind of thought of a similarity, in childcare. There's a crisis there. If you are going to have a baby or you're going to work and you need childcare or you need health care, most of the time people look for that before a baby is born or joins a family. And kind of the same thing when you're getting a pet, setting up veterinary care and making sure you have that established before that pet comes into your house and needs vaccines or needs to be spayed, because we really all strive to continue with care from puppy or kittenhood into adulthood, and we all really value that relationship, and we want to make sure that people understand that you need to set up and establish that relationship before you welcome a new pet into your house.
According to a study by Mars Veterinary Health, nearly 41,000 additional veterinarians will be needed to meet the needs of companion animal health care by 2030. Even with the new veterinary graduates expected over the next 10 years, a shortage of nearly 15,000 veterinarians will likely still exist by 2030.
Just anybody who does want to be a veterinarian or a veterinary technician, there's definitely always probably going to be a job for you, and it takes a lot of dedication to do it, but it is really satisfying and worthwhile, and you do make a difference. So, just encouraging people to pursue that and then come back to the UP or go to areas that are underserved, because there will definitely be a need for you.
In Marquette, Brianna McLean, Local 3 News.